It was a little girl. She was about 18 months of age, a toddler. She toddled through the kitchen, opened the screen door, walked out onto the back porch, and fell through a broken railing. She fell 3 floors and landed on her head on a concrete parking lot and came into the emergency department, and I was there. And I remember looking at her. Her eyes were open for a while. She went into a coma. She went to the operating room. She died 6 hours later. Everyone in the hospital, the nurses, the doctors, even the parents and family members said this was an accident. Nothing could be done. And that didn't seem right to me.
We created the Injury Center because Gary and I both approached the issue about injury control in children from different directions at first. And we started working together to plan a more structured approach to injury control activities for children. And that's how this all sort of started. And this was at a time where not much of this was being done.
It's the leading cause of death and disability for American children, adolescents, and young adults. Not cancer, not heart disease, not a virus infection, preventable injuries and violence. So our mission is to reduce this problem. Our philosophy is that injuries are not accidents, they're predictable and preventable. When we started, we were both doing this part-time. We had no budget. Now, fast forward 25 years later, we have 12 staff, 8 full-time equivalents. In 1990, we got our first little grant, $4,000 from the American Academy of Pediatrics. Last year, we had external grants and contracts over $850,000. So our work has grown, our people have grown.
We have 3 research priorities at the Injury Prevention Center. One is child-involved domestic violence and how do we protect children in violent homes. The second is youth suicide prevention. And then the third is our more traditional area of research, which is teen driving safety.
I think what's so special about the Injury Prevention Center here is that it really does represent a rich mix of really smart individuals from different disciplines, all coming to the table with very different but important perspectives.
Our medical anthropologists, surgeons, lawyers, people from all different areas. And when you get all of those different disciplines in the same room, you get an idea that gets presented and discussed and really morphs into something better with the expertise of all of the different disciplines that are in the room.
I'm a program coordinator for the Injury Prevention Center, and my role is to educate the community in how to do things in a different way, in a safe way, so they could avoid injuries. We fill that gap in a lot of the kids' lives where we bring that information to them that they might not otherwise get.
I know that when I wake up every day, I'm doing good work for the community and I'm actually making a difference in the lives of the people I'm working with.
I love injury prevention science and public health, but really what I love about it is being able to feel like the things that you're doing have meaning and that what we're doing is really affecting change.
It's hard to measure that impact, and that's one of the reasons why I actually enjoy working on injury prevention. Is because the impact is that it doesn't happen. You can't go out and measure the lack of injuries. All you can measure is a drop potentially in injury rates, and we have seen a drop in injury rates.
People were really skeptical about whether this stuff could be isolated, managed, and changed over time, where they could change people's behavior. And I think what we found over the 25 years is the answer is yes, yes, and yes, and that in fact you can change behavior, you can change outcomes, and you can reduce injuries and deaths.
So now we have seatbelt laws, we have a bicycle helmet law, we have graduated driver licensing for teenage drivers. We've reduced car crashes generally for all ages, but in particular for teenagers. We've reduced bicycle injuries, falls. So that's the work that we do.